Hi, my name is Alexandria Cram, and I did my disabilities presentation on muscular dystrophy. Muscular dystrophy is defined by the Center for Disease Control as a group of diseases that cause muscle weakness. There's also a loss of muscle mass leading to a decrease in mobility. Muscle weakness can cause the activities of daily living to be difficult. Muscular dystrophies are caused by a defect in the person's genes that interfere with the proteins used to create muscle. Prevalence in the United States of muscular dystrophy is very rare. There's little information, so the data below is from Northern England. Duchenne-Becker muscular dystrophy affects males only between ages 5 and 12. Myotonic muscular dystrophy affects males and females. Onset can be from birth to age 70. Limb-girdle muscular dystrophy affects males and females. Facioscapulohumeral muscular dystrophy affects males and females, usually by age 20, but onset is typically seen in the teens. Congenital and myopathy muscular dystrophy affects males and females, typically at birth or in early infancy. Distal muscular dystrophy affects males and females in the late teens up to adulthood. Oculopharyngeal muscular dystrophy affects males and females. Onset usually doesn't happen until after age 40. Emery-Dufus muscular dystrophy affects males only. Onset is usually seen between age 5 and 15. Typically less than 10 in 100,000 of each type of muscular dystrophy are seen annually, except for Duchenne-Becker. 1 in every 3,500 males are affected annually. Muscular dystrophy is classified as an orthopedic impairment by the IDEA Individuals for Disabilities Act. In Section 300.8, orthopedic impairments that affect a child's education are eligible for special education or related services. Other diseases under this classification are congenital abnormalities and impairments from other causes. Some of these are bone tuberculosis, cerebral palsy, and amputations. There are lots of ways to screen for muscular dystrophy. One is being screened in prenatal screenings. Others are blood tests to test for the enzyme serum creatine kinase that is found in muscle fibers that are deteriorating. Muscle biopsies can be done to test for genetic prevalence and what gene is being manipulated. Electromyography is an electric needle placed in the muscle to test for electrical changes in the muscle. There's also genetic testing that can be done to test for the manipulated genes in muscular dystrophy. The test can also be run on females to test to see if there are carriers for muscular dystrophy for the diseases that only affect men. There are also neurological tests to detect muscle wasting and to rule out other nervous system disorders. Heart tests are available to test the rate of heartbeats using an electrocardiograph. Muscular dystrophy can lead to heart problems later in life. Exercise assessment can be done to test respiratory function and overall strength. There are also imaging tests done by MRI and ultrasound. These are used to gain pictures of the body. Images are used to see where there's fatty muscle tissue and to view muscle quality. Identification and screening is done to see what available treatments are out there for the person diagnosed with muscular dystrophy. The idea is to prevent complications that result from weakness, reduced mobility, and cardiac respiratory difficulties. Psychological and behavioral, social, and emotional characteristics onset typically in early elementary school. The child is starting to have symptoms leading to more non-compliant attitudes due to outside stresses. In middle school, the student becomes more aware of their limitations, causing emotional distress and issues adjusting to change. In high school, it's very important for the parent and teacher to be wary of depression and anxiety signs in the student. The student is becoming more dependent on others as they watch their peers become more independent. Educational considerations in the classroom. A student needs an individualized education plan, IEP, or 504 plan in place. The student may also need special consideration for lateness, absences, bathroom breaks, visits to the school nurse, and missed classwork and assignments. It is important to understand that the student could be at risk for bullying, or that the student themselves could be a bully out of emotional distress. The best way for a teacher to help is to be supportive and be cognizant of any changes in symptoms and keep watch for signs of abnormal fatigue. Educational considerations for the parents. It's very important for parents to understand that this child still is going to grow up with the same mindset as their peers. So the parents should treat the child as an individual and understand that they are young and need help maturing just as any other child would. Parents should also answer any diagnostic questions honestly to their child to help their child better understand their diagnosis. It's also a good idea to get counseling for the child, the parents, and siblings. Group counseling and individual counseling is recommended. It's also important to consider local support groups. There are support groups for muscular dystrophy and for orthopedic impairments. The child and the family should go out and socialize in these groups to help familiarize themselves with families in similar situations. These are websites that I found for the classroom. There's also a YouTube video for the teacher and students to watch about muscular dystrophy. These are great websites for parents, including online support groups and books about muscular dystrophy. These are my resources, and that's it. Thank you for watching.